Great. Welcome, everyone, and thank you so much for joining us. My name is Amanda Stuckey, and I'm a principal for Health Policy and Insights at Economist Impact, which is the research and engagement arm of the Economist Group. I'm absolutely delighted to be moderating today's panel, and it's titled Towards More Equitable Access to Health Innovations, Strengthening Regional Capacities for Greater Resilience and Sustainability of Health Systems. This session is organized jointly by the Global Fund, Gavi, and the German Federal Ministry for Economic Cooperation and Development. To set the scene for today's discussion, we know that COVID-19 was particularly effective at revealing the impact of longstanding inequities in access to vaccines, diagnostics, and therapeutics. Many countries were dependent on a limited number of global suppliers and manufacturers, which had a direct impact on resilience and the capacity to respond. We've heard throughout the session so far at this summit the importance of learning from the COVID experience in the provision of health moving forward. On the flip side, we don't want to fight the last war, as they say. Having a forward-looking perspective is critically important, and it's really what this panel is all about today. A key aspect of this is ensuring equity in each stage of the continuum for quality-assured health products, from the incentives to develop and introduce new tools to supply chain and last-mile access, including for the poorest and most marginalized. It is essential to ensure effective coverage and that no one is left behind. In some of the sessions over the past few days, a number of colleagues have discussed the importance of speaking about equity not just as a theoretical concept, but getting to the point that we truly operationalize it in health. We're living through incredible challenges when it comes to the geopolitical and economic landscape, which we know exacerbate these inequities. In our recent research for Economist Impact's Health Inclusivity Index, we found that 1 in 5 of the 40 countries we studied had specific policies of exclusion that restrict healthcare access for vulnerable groups. In contrast, we found that the highest performing or most health inclusive countries tend to give individuals and communities the tools and innovations to take charge of their own health, which can result in improved life expectancy and related economic gain. Before we start this discussion, perhaps a question on your mind when reading the session title was, what do you mean by innovation? I want to ensure that we start with a common understanding. This doesn't just mean the latest treatment or the newest, best device. It also includes factors such as recognizing what doesn't work and focusing on more refined approaches to everyday processes and actions. Using this definition of innovation, we know that improving this landscape is possible. As we're sitting here in Berlin, Germany's leadership during its G7 presidency in 2022 and through its continued partnership with mechanisms like Gavi and the Global Fund, has had a key role in advancing this agenda, working toward more equitable access to and delivery of health innovations. With all of this in mind, we plan to have a thoroughly engaging panel discussion today, which will offer insight into maximizing impact by building on investments made in the last 2 decades, supporting regional capacities and strengthening health systems, identifying the role of inclusive, resilient, and sustainable systems for health to ensure early detection and control of outbreaks, and the deployment of health resources for current and future epidemics. And finally, demonstrating the impact through firsthand testimonies from partner countries and organizations about how strong and coordinated collaboration is crucial to address the challenges that will inevitably lie ahead. To accomplish these goals, we have a fabulous panel with us today. I won't list off all of their impressive accomplishments and affiliations, as that would fill our whole session, but I'll introduce them briefly now. With us today, we have the Honorable Kumbize Kindodo Chiponda, the Minister of Health of the Republic of Malawi. We have Dr. Arjan Hildebrand, Director General for the German Federal Ministry of Economic Cooperation and Development. Dr. Hildebrand took this role over since September, and she's here on behalf of State Secretary Flassbarth, who was unable to join us due to a last-minute conflict. We have Dr. Gitinji Gitahi, Amref Health Africa Global CEO, Kenya. We have Mariange Saraka Yao, Managing Director for Resource Mobilization, Private Sector Partnerships, and Innovative Finance at Gavi. And finally, we have Peter Sands, Executive Director of the Global Fund. A warm welcome to all of you. The last thing I'll note is as we get started, there is going to be time for Q&A, so be sure to be thinking about your questions, and I'll be opening the floor later. All right. So to get started, Minister Chapanda, I'd love to start with you. Accessing health commodities was often challenging during COVID-19, not only for COVID itself, but also hampering routine immunization, HIV, TB services, as well as malaria. Can you speak about how you tackled this situation, and perhaps more importantly, looking forward, what lessons your country drew to improve access to health commodities and to be better prepared for the future?
Thank you so much for giving us an opportunity to be part of this very important conversation towards more equitable access to health innovations and more especially strengthening regional capacities for greater resilience and sustainability of health systems. So for me, I want to start at the point of the experiences from COVID-19. Today, I want to celebrate the first pace which we took that time. All of us, we celebrated the vaccines when they became available. I think this is the first time we have developed a vaccine in the history of mankind. Unless somebody knows another experience somewhere else, but I'm not aware of that. I think this is the fastest time we have developed a vaccine which was a game changer, which was a lifesaver. And we are so grateful that it was made available even to us. We might have had some other issues, but still, I think so many lessons learned. In fact, maybe we are sitting here because of the lessons which we learned from the COVID-19, that we needed to have our own manufacturing capacity building in the regions, so that Central Africa, it is available, West Africa is available, even Northern Africa, it is available. Because of the lockdowns, things were late to get to us, but those are the lessons learned. And to me, I think now we have an opportunity that we need to develop our capacities, and that is why I was really happy with the way the regional capacities, very, very important. Because there are certain issues which are global issues, like COVID was. Global issues. Then there are issues which are regional issues. We are suffering from the cholera outbreak, the West cholera outbreak, and that was a regional because it affected Malawi, Mozambique, and Zambia. It affected our region, including Tanzania as well, and part of South Africa. That was a regional issue. And then you have national issues. So I think the issue to me is that when it's a national issue, it doesn't receive the same visibility or platform. So people do not talk about it, and if it's not being talked about, even funding or support will not be as it was with COVID. COVID, everybody was willing to give because everybody was like, it might be me next. But when it's happening somewhere else, it's a bit different. So that is why I'm saying it is a very, very good conversation which we're having today, building our capacities, national capacities. We are talking now with the help of African CDC, how do we strengthen our public health institutes in the African region? Very, very important, because that we talk about the surveillance, so that we can be able to pick issues as soon as they happen, as we're able to pick the polio. We had the one case of polio in a long, long time, but we were able to pick it and address it, giving vaccinations to all the children under 15 years. About 9 million Malawian children which we vaccinated within a period of 1 year. So we need strong surveillance. So we also need to build on that. But the other issue is that The speed which we showed during COVID, some of us would want the same speed to address the issues like HIV. Why is it that till now we don't have the vaccine for HIV? Why is it up to now, okay, at least we have now a malaria vaccine, but then how many manufacturers are interested? Very little. Not too many. Cholera, we have the cholera vaccine, but we have a shortage. As we are talking now, we have a shortage. Maybe there's 1 or 2 manufacturers. It means most of the people, they're not interested, or the companies, they're not interested in manufacturing cholera. So what is it that we can do, so that we address these real issues which are affecting us? So these are the issues. So if we had our own robust manufacturing capacity within the region, then they'll be able to say, okay, we will concentrate on malaria vaccine and making sure that then it means we eliminate, because we have been talking, let's eliminate malaria by 2025, 2030, but what are we doing to do the elimination? Very little. We are grateful that we support with them from Global Fund, USAID, Gavi, they support with the nets, what, but all of us, at least if we make the vaccine available, then we have companies interested in manufacturing. Cholera, elimination of cholera, it has been eliminated somewhere, but if it's in Malawi, it means it is still there. So what should we do? We know the game changer, one of it is the vaccine. Why is it not many people or many companies are not interested in manufacturing the same? So these are the innovations which are already there, which I think we have to do something that we strengthen them, because these are game changers in our communities. They will address the 50% of the disease burden which we struggle with. They're going to save lives, but they're also going to bring a financial dividend as well as also an economic dividend in our country. So I think let me stop there for now. Thank you.
Thank you very much, Minister. Your firsthand insights offer both a clear picture of the opportunities and the challenges that we're faced. Thinking about the role of partnership, Ariane, Germany has been a champion for global health inclusion through COVID-19. Given the challenges across and within many partner countries, can you elaborate on how Germany's been working with countries and partners to increase access to quality-assured health products, and what role regional and local manufacturing capacities can play in this?
Yes, thank you, Amanda. Germany, global health has been a priority actually of Germany for many years, even before COVID-19, with a focus on universal health coverage, and it is also a strong priority of our Minister Svenja Schulze. We support countries in building sustainable health and social security systems. And the COVID-19 pandemic put the spotlight on inequalities and weaknesses of many health systems worldwide. I think probably all health systems, including Germany, in a different way than the Global South. We heard from Honorable Minister Chiponda what it means if people don't have access to essential health services and products, and these inequalities in access to diagnostics and vaccines and therapeutics need to be addressed. The pandemic agreement must become a powerful legal tool. We must conclude this agreement and regain lost trust in our partner countries. Now, let me highlight a few of the areas of our German support. Of course, we invest in health systems, we invest in labor force, particularly also in women. We invest in regional and local production, and we are the third largest donor country for Gavi, the fund, and the pandemic fund. In some more detail, I would like to mention 3 areas. First of all, the support for regional vaccine and pharmaceutical manufacturing in Africa. We strongly support the African Union's goal to reach 60% of local vaccine production by 2040. We cooperate with the African Union, Ghana, Rwanda, Senegal, and South Africa. We committed over 550 million euros to this. It's also part of the Team Europe initiative, which has a total sum of over 1.2 billion euros. And there's a focus on workforce development and capacity building for regulation authorities. The aim is to improve supply security and to help reduce dependencies from non-African manufacturers. One of the challenges, of course, in order to be competitive, local manufacturers require sufficient demand for their products. And that is also why we work closely with Gavi, the Global Fund, and our partner countries to shape global pharmaceutical markets, with Gavi and the Global Fund being some of the largest buyers, of course, of medical products in the world. We also advocate for the adjustment of their procurement processes towards absorbing more regionally manufactured products. And we strongly support a new Gavi financing mechanism to improve the competitiveness of African manufacturers by initially paying premium prices. This will cushion the initially high manufacturing costs of regional production in Africa. Finally, we also support the Global Fund's ambition to support capacity building for regional manufacturing. So this was about regional and local manufacturing. My second point would be investment in health impact investment funds through our KfW Development Bank. This is our implementing agency for German financial cooperation. We provide higher risk capital in these funds to mobilize private investment to support young and innovative health companies and support market readiness of innovative products. Micropatches for vaccines being one example. The focus is on development of innovative health products that reach vulnerable people in poorer countries, especially women and girls, also persons with handicaps. With a volume of 50 million euro, BMZ is one of the biggest supporters of health impact investment funds. Investment in pandemic prevention and preparedness and response is the third point I would like to mention. Founding member of the Pandemic Fund, we are here again the third largest donor country, and this is an important instrument, of course, in global pandemic prevention. My ministry supports fair solutions and access to technology, know-how, and data sharing, as well as the One Health approach as pillars of the pandemic accord. So, for our ministry, strengthening regional capacities is key for resilient and sustainable local health systems. This is the title of today's meeting here. And of course, the cooperation with the civil society is also key for BMZ in designing needs-based approaches. Therefore, I'm also glad to be able to discuss with my colleagues here, Dr. Gitahi, and my esteemed colleagues from Gavi and the Global Fund, with whom we work together in many areas. Thank you.
Great. Thank you very much. So much important work going on. Thank you. Dr. Gitahi, I'd now like to turn to you. There's already been a lot of important insights shared, but I wonder if you can add your perspective and insights into the situation that people in your country are facing when trying to access quality-assured health products. How does this extend to the most marginalized parts of society? And how has AMREF been working with partners like the Global Fund and Gavi alongside government?
Like Germany, and thank you very much for your support to the Global Health Germany and your continued support to the multilaterals. The challenges that we have are many, and you can summarize them in a systematic manner. I think the first thing is the issue of financing. The reason that we have our friends Gavi and Global Fund, and as expressed by the minister here, is because of the issue of access, and that access is driven by the fiscal space or the lack of money. In my country, which is part of the African continent, we spend $43 per person per year on health. That's government money, 43. Germany spends maybe $5,000. So you can see that already is a problem, that financing the commodities or the products and technologies and innovations that are needed is already a problem. Because with that 43, you have to pay all your health workers, you have to maintain service delivery, you have to pay your policymakers and everyone, and then pay for innovations and health products and commodities. So it's a big challenge around there. But then this challenge is compounded by security of these commodities, because most of these commodities are imported. For vaccines, as we said, only 1% of the vaccines that Africa consumes, even out of COVID, under a normal year, with our birth cohort and the childhood vaccination, only 1% are actually manufactured in Africa. 99% are imported. So that means that even within your vaccination programs, you have to be dependent on availability of these commodities. So your planning becomes dependent on other people's forecasting. And we saw that during COVID, that it was so bad that whereas in some countries there was money, because it's not all countries that are spending only 43. There are countries like South Africa that have more money, other countries in Northern Africa. But even with their own money, they could not access, vaccines because they were coming from outside. There are countries like my own that went to the World Bank and borrowed money. My country borrowed $150 million from World Bank to purchase vaccines. But even with that, we couldn't get the vaccines because they're not available. So there's a whole structure around the sourcing, but also which is complicated by the low fiscal space that exists. But the other challenge that we see is quality. That because you're purely dependent on imports, and there's no coordinated mechanism for that procurement, quality maintenance becomes a challenge. You've seen cases, I think it was in Ghana, where we had children die because of a cough syrup that was not, So this is a big challenge across. And even, my friend the minister here will bear me witness that ensuring that you have quality products that are all coming from outside, that even when you need to buy them, you need to go and see the factory, then come back. Maintaining post-market surveillance or pharmacovigilance is extremely difficult. So those are some of the challenges. The next challenge is the health workforce, of course, that even when you have these products and innovations, delivery is a problem. Africa has the lowest health workforce density generally. So we found that even when we had the products, I'll just give the example of vaccines, because that's fresh in our minds. When the vaccines came, we found that the speed of delivery, especially to the most vulnerable, was very complicated. Complicated by many things. Number one is that we don't have easy access and near access of service delivery points and health workforce to everybody. Some people live 100 kilometers away from service delivery. The health workforce density is low, but also operationalization of existing cadre of health workforce. In Africa, pharmacists, for example, were not allowed by law to vaccinate, to give injectable treatment in many countries. So whereas in Europe and North America, we found a lot of people accessing the vaccines from pharmacies, in Africa, you had to go to a facility because only a nurse, clinical officer, or doctor could actually administer an injectable. So it's again a policy gap around there. The final point that I want to make here is on movement and people-centeredness of the health system. Majority of the people in the continent, even when you have access to commodities, are not far, but also because they're informal. Time to access the commodities becomes very difficult because you're selling vegetables, you're going to a plumbing site, you're a mason, and if you need to pick your innovations, either your HIV medication, TB medication, or hypertension or whatever, it's difficult for you to actually lose the income for the day because they're earning by the day. So all these are challenges. But you asked about how we are working with Gavi and Global Fund. First, I would like to say that we've gone through a whole courtship process. We went through courting, now we are bonding, and I think we are moving to commitment. So our dating is going to go to a full marriage. What we have seen when we started talking about injustice and all these things, we were in a place of disempowerment. Like we're feeling we have so little control of the money and the structures of power that even as we actually start to talk about them, we don't know the reaction of those who have power, what they're going to say. But we still went ahead and lent our voice on TV and talking to individuals and calling out the injustice. But what we found, and I must thank them, is that now, actually that bonding is moving to commitment. We have much better conversations with the Global Fund and Gavi. We've seen that even in terms of innovation, we are now talking about local manufacturing and also demand creation, demand aggregation across the continent, and discussing with Gavi that they're actually going to work with us, Africa CDC, the countries, to ensure that even when we manufacture locally for distributed supply chain, that they're going to support that. That was a conversation before COVID that we only had in our dreams. And when we woke up, we deleted it because we thought it will not be a very comfortable conversation. Global Fund, the PEPFAR, are now discussing how do we source mosquito nets, how do we source malaria RDTs in Africa. So it is now a collaborative effort, a respectful partnership to see that actually we can build this capacity for the future together. So I think that's what I would like to say for this question. Yeah, thank you.
Thank you. One of the first points you started talking about was the financial side, the fiscal space, and what better person to comment on that than Peter Sands. Health programs supported by the Global Fund partnership have saved over 50 million lives in low and middle income countries. As a major funder of HIV, TB, and malaria commodities and health system strengthening, the fund has a key role to play in ensuring equitable access to health products and innovations. So Peter, I'm curious how the Global Fund is contributing to this end, including reaching the most marginalized parts of society, and particularly what innovations do you expect will be a game changer to accelerate progress in this next funding cycle?
Thank you. Well, to start with, we procure or enable countries to procure about a couple of billion worth of medical commodities every year. And actually, before I go any further, I should say we wouldn't be able to do any of that without the incredibly generous support of donors like Germany. So we are hugely appreciative of ultimately the taxpayers of Germany for their contribution. So we procure about 2 billion a year, but we don't do that just in a kind of passive way. We're actively doing two aspects of market access. One is around reducing the price of the products. So for example, this summer, this August, we secured a 20% reduction in the price of antiretroviral treatment down to now $45 per year. Now, when you think that there are 24.5 million people on antiretroviral treatment, that's a big saving. Also, when the Global Fund was created, we were talking $10,000 a year. So there's been a massive change over the period. That's one aspect. The second aspect is around decentralization of manufacturing, localizing manufacturing. And we have a number of things in train right now. The most advanced is around a formal process around seeking tenders for African-based manufacturing of HIV diagnostics. And we're having a conference actually next week on HIV antiretrovirals in Maputo. And we're deliberately focusing on areas where there is sustainable demand, because I think one of the risks is of investing enthusiastically in things where actually the demand doesn't sustain the economics of whatever the manufacturing facility is. So that's one aspect of it. The second, however, as others have mentioned, is it's all very well having the products. You've actually got to get them delivered to the people who need them. The Global Fund is the largest multilateral provider of grants for health systems. We invest about $1.5 billion a year. It'll be going up to more like a couple of billion as of 2024 a year across a whole range from community health workers to lab systems to primary healthcare facilities to supply chains. The needs being driven and the priorities driven by the countries themselves. We'll provide technical assistance through partners, but ultimately it's the countries who determine the priorities. However, there's a third dimension of access that I think we should also talk about, which is, well, you talked about remoteness. I would add policies, because in some countries, those most at risk are criminalized or stigmatized in ways that make it difficult for them to get access. So you may have the product, you may have the primary healthcare facility, but if somebody thinks they're going to get arrested if they go there, that's not going to work. Secondly, in a depressingly large number of places, conflict is a massive barrier to access. And we're having to work with a whole range of different partners. Often the most resilient are actually civil society partners to work out ways of sustaining access. And that's not just true in Africa. I mean, in Ukraine, for example, our civil society partners on the ground have done an extraordinary job in adapting to a situation where the primary healthcare facilities have been destroyed, the people have moved, you still have to provide continuity of service. You asked about sort of innovations, and my only caution on this is the reason we're still fighting AIDS, TB, and malaria after all these years is these are formidable diseases, and they're extremely difficult to beat with just one thing. And there's a kind of an illusion that around the corner there's this magic silver bullet that somehow or other we will discover. The reality is we have to use an array of tools, and I would say there's two big things that we can do. One is we have some tools that we're not fully utilizing already. So if I think of HIV, one of the most powerful tools in the rich countries in the world has been PrEP. But we have underutilized PrEP in many parts of Africa. And so we could do much more with that, and particularly with the long-acting versions. But we also need to get the newer tools, the innovations, to the people who need them faster. And there's a sort of, COVID exemplified the issues and how it took longer to get vaccines or diagnostics, or indeed, if people know about the inequities in COVID around vaccines, I can tell you the inequities around COVID in access to oxygen were even sharper. I mean, basically, it wasn't available in many places. And so we need to leverage these tools, and we need to get them to people much, much faster. And the good thing is that actually we do have a really exciting pipeline of new tools across many of these diseases. So I mentioned long-acting PrEP for HIV. The vaginal ring is also a very powerful, potentially very powerful prevention tool. In malaria, I'm sure Marie-Ange will talk about the vaccine. But the vaccine isn't the only thing. Probably the single most important thing right now in terms of innovations in malaria is the dual active ingredient bed net. Mosquitoes have become resistant to the main insecticides used in bed nets. There's a new series of bed nets being rolled out right now, which has two different insecticides and is like 48% more effective, and fortunately only costs about 70 cents more. Now, when you're putting out 180 million nets a year, that makes quite a big difference. And so we have the opportunity right now to actually protect households far better than we could before for relatively little. And then on tuberculosis, there's a range of different things. Just one I would mention is mobile digital X-ray, which you can put on the back of a Toyota Land Cruiser. You can use AI to do the scan, to do the interpretation of the results, and that'll enable us to screen more people faster and more accurately than we've been able to do before. So there's no shortage of good new tools. The question is how quickly and reliably can we get them to the people who need them?
Absolutely.
That's all for me.
Thank you, Peter. That issue of scale is incredibly important, and one of the tools in the toolbox that you mentioned that is also incredibly important are vaccines. Vaccines are the innovation that's helped combat many infectious diseases over the past 100 years, improving life expectancy by about 50% in the last 30 years alone. Marie-Ange, as the world's largest buyer of vaccines, Gavi has a key role to play in accelerating access and introducing innovative immunization technology. Can you describe the ways that Gavi's working towards making vaccines, and especially new vaccines, more accessible in low-income countries? And similar to the question for Peter, what are the innovations that you would expect to be hitting the market in the next 5 to 10 years?
Yeah, thank you, and thank you again for having me here, and really a pleasure to come back regularly to Berlin to talk to this audience. I think there are several ways in which Gavi, works to make vaccine available. I think really the first one on the supply side, and it has been hinted by a lot of the speakers before me, is working at the same time on the market and on the financing. And I think it's very important because the minister talked about how there's not enough cholera manufacturers and maybe they don't want to come to the market. It's actually that we know, in a sense, Gavi is an aggregator of the ecosystem. So we have the, in a sense, the chance of being able to have the producers, the countries, of course, donors and the generous support of donors like Germany, and the research institute and the key agencies. And so it's understanding better what's needed, but clearly, before we even talk about shaping markets, sometimes what we have to do is create that market, make it clear to these manufacturers that actually there's a demand, there's how many people, that's what they need. And also, hey, thanks to the support that we have from our donors, we have a 5-year runway, so we can enter into business. And this is very important because vaccines actually is a little bit like infrastructure. It's very capital intensive, so compared to other medical products, and also the barriers to entry are extremely high. We've talked a little bit about regulatory quality. You talked to Gitinji. So you can get access and you can lose access after having put $1 billion and these type of things. So what we do, in a sense, we create that market and we guarantee that market and say, look, we know that in Malawi how many children are born every year and that we need X, Y, and Z. And guess what? We are going to add a delta in case there's an outbreak so that, when the time comes, we have the vaccine available. So that's really what a big part of our job is. But matching to this, of course, we need to have the right financial instrument, the right innovative instrument, so that we can play around. And, we have developed, of course, quite a few innovative instruments. One of them, very famous, the vaccine bond that allows us to play over time. Being able to front load the money when it's needed, and we did that for Ebola to accelerate the vaccine and create the vaccine. We know, and we have used it for other things. So that's very important because it's not just the financing; it's the quality of that financing. It's knowing that the financing is not just 2 years, 3 years, but we can have a 20-year visibility. Because that's what this type of market requires, so that people research, so that people can develop a plant. So, what I would want to say also, the big innovation is, of course, that what has been incredible has been actually the partnership with countries like Malawi, because we are investing together. I mean, in Gavi's financing, 41% comes from the countries. And over time, it has grown and has increased from 8%, just a decade ago. So it means that what's fantastic, there's this appropriation that, that they are contributing because it's so important. And regardless of, I know I hear a lot, and I heard it at the beginning of the conference, people thinking there's fatigue, but it's not true. There's not fatigue from ministers like we have on this table, not at all. And that's very important. So now, of course, what we are looking at is learning from the pandemic. I think one of the things we learn is that while we have worked a lot to create global markets, during the pandemic, actually, it didn't work so well because, borders were closed, and so the ability of products to move. And I think that's what, has created this other willingness and commitment, as Gitinji talked about. We are not yet married. Huh? I think he has to court a little bit more. We won't let him off the hook so simply, but we have now to look at regional manufacturing because, in a sense, it's about supply resilience. But also, and I think that's where we have to project ourselves, is also to look at what type of new products we need, what type of new innovation we need. And it's true that, before, we are talking about global vaccines. So vaccines that were needed here, but at the same time in Malawi, in my own country, Côte d'Ivoire, or in Brazil. And now, you know what? We have vaccines that we need particularly for Africa. We have vaccines that we need particularly to Asia. So it creates even more the opportunity and the business case for having regional manufacturing. But there, again, we have also to be realistic, and we have also to work all together, because the financing is just one piece of the puzzle. What Gitinji talked about having money but not product, it's because we had money, but not money at risk. Because actually, if you want innovation, you have to finance innovation. So you need to have a bit of that money to finance it at the same time as everybody else, so that you have a piece of the pie. It's not just when the product is finished. And that's what we have also to work more, learning from the lesson, the at-risk financing. Of course, at Gavi, we learning a little bit late. We develop new products for this that now are available, and we need to continue doing that. But the regional manufacturing is very important, because what it means is plugging African manufacturers into a global system that is competitive. So the mechanism we are thinking about, really talking about the next innovation, and that we think is truly innovative, is being able to have an African vaccine manufacturing accelerator that is a 10-year instrument to really support financially over time the entry in competitive African products into the market. Because what you don't want is distort the market, because we can have great products. Peter talked about how some of the prices have decreased. We have had the same thing. Now the vaccine the cost of the vaccine package for children, as recommended by WHO, that we procure at Gavi, is $24 per child, compared to $1,300 in the US. So you don't want suddenly that price to increase, because you don't have enough economies of scale. So you want to allow that smoothing, and it's possible. It's absolutely possible, because also you have other type of innovation that allow us to, be faster in terms of the way we do the products. I think the other innovation, of course, that is very important to think about, and is innovation on the demand side, and especially on the delivery, because now we can be so much more efficient in delivery. Thinking how we can deliver better. We have started, for example, drone delivery in a few of the countries 24/7. It actually decreases the cost of delivery by 50%. Of course, the digital, technology will be very important. The innovation in the cold chain system, we are working on it. But also the greening of the health system, that will be very important, because again, it's not just that the system is static. We are seeing the impact of climate change. A lot of the vaccines, the disease we are talking about, are climate sensitive, malaria. That's why we are fortunate to have indeed now a second product coming into effect. But it has to be worked, of course, with the other interventions, but also planning. So that's why I think we think the localization will be important, because there's an increase of all these products that need to be available.
Absolutely. Thank you. So I have a couple of questions now for the full panel. We've talked about a lot of challenges and equally a lot of opportunities and progress. But a question that naturally comes to the fore when we think about supply chain and financing and all of these topics is really, where do you start? Or maybe not start, but where do you continue next? What are you going to do tomorrow? So I'm curious for all of you, kind of based on the lessons from COVID and response to other diseases, what are the most important challenges, the most urgent challenges we need to tackle to ensure more equitable access to health products, including health innovations? And as you think about these, everyone on the stage right now represents really important partnerships and collaborations. So what synergies can be created by this collaboration among global health actors? And we'll go in the reverse order. So maybe, Marie-Ange, we could start with you.
I think that's when we want to get to the marriage part, because we all need to be working very closely together. So, But I think, I mean, for me, two challenges: the at-risk financing, because for all the talks that have been going on, we need to think about it further, of how, you know, we can have at-risk financing to be able to start working on innovations with others to be part of the queue. So I think that's extremely important, because it's not, you know, of course, we have started looking at it on the vaccine side, but we do need to have system for the whole countermeasures for all the medical. So it is very, very important. You know, it's striking that the countries that were the first able to put so much money to encourage this were the first ones to have access. You know, so that's really key. I would think. The second one, and that we have not talked so much about, is really on the people side, reassuring them about the products. I think that's very, very important. It's a new factor. For example, on vaccine, you know, in fact, the countries we have been working on have always had a great acceptance of vaccines, because in a sense, it's a matter of life and death. You don't have a doctor at every corner. And but now, of course, with the COVID-19, with the prevalence of social media, you have seen more of the doubt. So what would be terrible is that we are able to have localized products, and finally the people don't take them. So we do have to work more on explaining, on building that trust. That would be really, really important. So for me, these are the two things that we have to work further on.
Absolutely. Peter?
A few things. One is regulatory approval pathways, and also combined with that, post-market surveillance. If you look at something like rapid diagnostic tests for HIV, there's no problem in giving a sustainable market. There's no problem in financing. The issue is that you can't build a business case if it takes you 2 years after you open your factory to get approval, because you can't sell anything for 2 years. And we're working very closely with WHO on a sort of an expedited process to facilitate that. But there's a broader set of issues around the pace at which we can get approvals for innovation and get appropriate guidelines and so on. A second issue, and again, all these issues have to be solved through partnership, because none of us is in a position to sort of pull all the levers, relates to actually there's not enough analytical work that helps countries decide the optimum mix of tools to use. And we're gonna run into this with malaria, for example, is where are the highest priority areas to use the malaria vaccine versus other interventions? It's a relatively expensive intervention, but it's a really valuable one, but we need to have a prioritization of it, and that's gonna require Gavi and the Global Fund to work closely together, but it's also gonna require ministries of health to have the tools to be able to do that analytical work to optimize in their own context. So those sorts of tools are critically important. I'm afraid to say I'm going to come back on one issue that is sort of slightly different from the whole sort of focus on science and procurement and manufacturing. Is, you know, the big issue we face with HIV right now is we have great tools, but we have people who can't get access to them. And that's a human rights issue. And so when we talk about equitable access, it's not just about the science, the manufacturing, it's also about things like human rights and, as you know, can people actually get those life-saving treatments?
Great, thank you.
Yeah, in addition to everything that has been said, we learned several things. The first thing we learned is that multilateralism is always at the mercy of nationalism. That was a very clear message to us, which then led to, in fact, some of the presidents of the African Union made this remark and said, you really cannot expect to feed your children or your neighbor's budget. So you have to build capacity, and that calls for us building capacity through our domestic resources, but also just building capacity through, you know, strengthening our health systems. But at the same time, we have to think about how to build that capacity for not only for Africa, but for a globally distributed system. I think the assumption that part of the challenges for Africa are going to be solved by Africa manufacturing for itself are assumptive. I think that what we need is that we need Africa to be part of the global supply chain. That means that if India has a problem, Africa can supply India. If, and it becomes like of a global distributor, which means therefore that we have to think about the investments we make across the world for that distributed network, what the quality of those products is. So it must be built not for a particular region, but for the world, and also to build the capacities to support it, meaning that things like research and development need to accompany that capacity of manufacturing, regulatory ability, as was said earlier, because we have products now, in Africa we have 55 states. So when you get a product, an innovation coming, and then you register it in one country, you have to go to 55 countries. Now there is the AMA, that the Africa Medicines Agency, that's going to solve that. So we need that capacity to be drawn together. The next thing is that we discovered that when there is a choice between losing the market or losing equity, people would rather lose equity than the market. Countries and people protect markets, and that was a difficult lesson for us. Therefore, it means that things like intellectual property and R&D for that intellectual property need to be a public good, because if they are left to the private market, they'll always fail when equity is what it leads. So the question then is, how do you invest in R&D that can actually protect equity? That can only be done with public money. So we need to think about how do we actually use public money to support research and development. We are happy that the governments here and others are supporting CEPI to produce vaccines and technology for the future, are supporting, of course, the science and delivery that are being set up with Gavi and Global Fund, and we need to use public money to protect equity. So that is another lesson that we learned. And that means the final point I want to make is around this issue of trust. Trust, authenticity, and respectful partnerships. We learned that trust was so critical to everything we did, including community delivery. So we have to build trust within ourselves, and that's why I was making on the light note, the fact that we are headed, our dating has not been too bad so far. It's not perfect, it's not been too bad, but that trust that actually we are addressing the same problem and not being seen as implementing CSO, and you're an implementer, therefore you have to wait for our money, and you can't be on the same table because we are not sure whether when we sit with you, you're going to ask for money. I think that trust between CSOs, global health initiatives, government and communities is going to be critical, but trust is on the foundation of authenticity. Are we authentic about ourselves? Are we authentic about who we are representing? Is our voice authentic, or is our voice laden with self-interest? So I think we have to think about that. And finally is that will underlie respectful partnerships, that everybody is a contributor, irrespective of whether you are in the private sector, you're in government side, bilateral, multilateral, you're civil society. We must recognize that every voice matters, because lived experiences are actually more important than published data. Thanks.
Thank you.
Well, a lot has been said before, but I would still like to emphasize again capacity on the ground in health systems. I have learned that vaccines don't save life, but vaccination does, and that makes sense to me. And therefore, capacities on the ground and workforce is an important thing. Also, data and surveillance, I guess, very important. Anyhow, the pandemic has shown that global challenges need joint solutions. That, of course, is also very important point. It's important to learn from the mechanisms set up during the pandemic, such as the COVAX. This is also why we as Germany fully support an interim medical countermeasure mechanism for equitable access. Before we have the pandemic agreement, we must not lose time, but work on interim solutions. That is important. Another thing that has been mentioned before, challenges challenges not only between countries, but also on a domestic level. I think Peter Sands mentioned it before, that there are domestic level challenges that need to be addressed, like for instance, legislation criminalizing vulnerable groups in societies, and also scarce or not accessible medical services in conflict zones. I think that's been mentioned before, but it's an important point that we should not forget. Efficient collaboration, especially with the civil society and community-based organizations, is key to reach the most vulnerable groups, and therefore Gavi and the Global Fund provide successful examples. And complementary coordination and cooperation at all levels basically are important to achieve strong health systems, and therefore I also applaud the Global Fund's commitment to invest 1/3 of its funding in resilient systems for health and pandemic preparedness, and we also welcome Gavi's financial support for health systems strengthening in partners countries, accounting for 1/4 of the total budget. I think these are important steps to work on the challenges that we all see. Thank you.
Thank you.
Thank you so much. So for us as countries, Malawi and also my colleagues, is that there have been a number of challenges. The first one, which I can point out to, has been fragmentation of services. What I mean is that the health sector, you get so many partners, and most of the partners, they were disease-centered. So you find that for Malawi, we have done very well in terms of managing HIV. We are maybe the top ones who are meeting the 95 and 95 and 95. We have, there's no more transmission between mother and baby. So we have very, very good outcomes. And that has been possible because of the support which we get from our partners like Global Fund and others as well. So you have this woman, you have saved her from HIV. We have saved so many children from becoming orphans as well, because of the interventions, the innovations in the HIV sector, HIV/AIDS sector. But then the same woman should have some other non-communicable disease, hypertension, and you have little support towards the same. You see? So these have been the real challenges on the ground, mental health issues. We're talking of adolescent issues as well. Adolescent, you get support for family planning, whatever, all those things. But then for family planning, I need a community healthcare worker to give that family planning, to advise. You're talking of rights, sexual and reproductive rights. Our children, they need information. Who is going to give that information? If I have a community healthcare worker, whether it's a midwife assistant, whether it's a nursing assistant, somebody in the community to serve them, but to get little support towards, recruitment or maintaining our community healthcare workers. So for us, we feel that, to address this challenge, we're advocating for our partners, so many of them, to support country plus country programs. We are saying, as Malawi, now we have one plan. One plan, so we want all of us to work together. You bring in your portion for whatever, HIV, tuberculosis, then Gavi brings in to manage the vaccination. We have the German government through GIZ supporting us, infrastructure, so many things supporting us, family planning as well. We have AMAREF also supporting in terms of training and other things, so that, when we put our resources together, then we can take care of all the other issues. Okay, this one we are doing very well. What are the challenges? No, infrastructure. So many women, they're walking 50, 20 kilometers just to have access. No, we need to build something. Okay, resources, which resources? Global Fund say, okay, we will build 1 or 2. They build, Global Fund build, but it's going to give, support to all the services. We have talked about the maternal, under 5, things like those. So that is why we're advocating that we have one plan, and then we follow that plan. We do the budgeting together. The monitoring and evaluation, we do it together. Country and all the partners who are working in that sector, instead of, like it has always been, the vertical programs. Some of them very successful, some of them are not so successful. The HPV is not successful as much. In our country, we need to do more. But you cannot address issues of cervical cancer, whether it's screening under a tree. You cannot do that. So I might have a partner who is giving me the vaccine. Gavi, very good, they have given me the vaccine, technology for screening. Where do I screen this woman? We can't do it under a tree or in a classroom. I need a safe space for them, dignified space for our women, to encourage them to create demand as well. So for the first challenge, that is what I think. The other one, of course, is the health workforce. I've already addressed it. And of course, financing, already mentioned by Maria, financing. We are operating under a very tight fiscal space, but we know as countries that we also need to do more. So for us as Malawi, we have already initiated the health financing dialogue so that, citizens, private sector within the country, civil society groups, they also have to put in more. Apart from what we get through the Treasury or Minister of Finance, we are encouraging all citizens to take an active role to making sure that we put more in our resource envelope, apart from what our partners they are bringing in. Thank you.
Thank you, Minister. Okay, I had promised some time for Q&A, so I'd like to open it up to the audience, but first, I'll be doing that in just a moment, but I'd like to welcome comments from Jörg from MMV before we open it up to the Q&A. Yes.
From MMV, the Medicines for Malaria Venture, and thank you very much for providing the opportunity to show the perspective of medications against malaria on this program. So I learned today only 1% of the vaccines that are used in Africa are produced in Africa. In malaria, the situation is almost as dire. 90% of the malaria cases are in Africa. 90% of the anti-malarial drugs are imported. At the moment, there are 5 pre-qualified manufacturers in Africa and 1 manufacturer with 2 products for antimalarials. MMV is working towards a more equitable access to the people in need, to the vulnerable populations. And we are also working with African manufacturers. So the 1 manufacturer in Kenya obtained the pre-qualifications with our support, and we expect that before the end of the year, another 2 manufacturers in Africa obtain pre-qualification. What we see here is it's a joint effort. It's a joint effort between all the players. So we very well come the initiative from the European Union and the German government on the joint actions support towards industrialization and the productive sector. We also welcome the meeting that Peter Sands has mentioned in Maputo, where it's mainly about the discussions between manufacturers for antiretrovirals and the global procurers, but also antimalarials will play a role. I think it's also important to recognize the role of collaboration between current manufacturers and African manufacturers. Without their support from the current manufacturers, it would be much more complicated to obtain quality-assured products manufactured in Africa. The last point I would like is really the sustainability. Ms. Hildebrand has, and I'm really grateful, the initiative from the German government on the market shaping, that products that are produced regionally might, at least at the beginning, have a premium price and might not be as cheap as a huge bulks produced in India or in China. But I think also what Peter Sand mentioned, you said for manufacturers, it's impossible to keep a manufacturing site quiet, dormant, between finalizing it and getting the regulatory approval or the pre-qualification. But it's also impossible to keep that site open between pre-qualification and the time the first orders are placed. So, and we have seen with other manufacturers, not necessarily malaria, that they gave up during the time when they had the quality assurance, when they had the pre-qualifications, and the time where they did not actually get the production, the orders to run the productions. Thank you very much.
Thank you, Jörg. Okay. So for Q&A, we have 2 microphones in the center aisle. If you can, feel free to go to either microphone. To maximize the input to the audience, from the audience, we'll take 2 or 3 questions at a time. And I'll ask the panel here to work and practice on your marriage to make sure that all of these questions are addressed. Please feel free.
Great. Sam Rick with AVAC. We've heard a lot of big talk about everyone's commitment to equity. Everyone's very concerned about it. Everyone's very committed to it. But we also heard comments from the EU and Germany yesterday that they have a red line on anything relating to IP in the pandemic accord, any time-bound waivers, any compulsory tech transfer. We've heard a lot about the importance of local manufacturing, but I'm not really understanding what that will do for us if, like in the mRNA hubs case, they have to take 8 months to reverse engineer a vaccine that already exists. So what are the actual concrete commitments that people are making to equity, and where can we move forward if there's all these red lines?
Thank you. In the back microphone.
Thank you. So my name is Sarah Rotenberg, and I'm a fellow at the Missing Billion Initiative. We know there are 1.3 billion people with disabilities worldwide who have a 2 times higher risk of contracting HIV and also have less access to knowledge about HIV and testing. And so how do we build on this in the spirit of making it greater equitable access and include people with disabilities in HIV care, as well as thinking about future innovations? How do we move forward and be more inclusive of people with disabilities? Thank you.
Thank you. We'll take one more.
Hello everybody. I'm Dr. Fazza Faragha. I run a telemedicine-based organization out of Pakistan and enable healthcare access using digital technology. And I think when you're talking about equitable access and healthcare innovations, telemedicine has proven to be a good enabler, particularly after COVID. And I think one of you talked about the role of digital healthcare in enhancing access and equity. And I would love to get to know more if you people have had the opportunity to work in combining access, awareness, particularly towards vaccines and also digital healthcare in your work, and if there's a plan for that. Thank you.
Thank you. I hope everyone remembers all of these questions. Perhaps, Marianne, would you be willing to start?
I think there's another.
Yes, we'll do another round of
Okay.
questions.
Okay.
Yeah.
Thank you. I mean, look, I think there was a question on what exactly does it mean local manufacturing and concretely. I mean, to be more concrete, what it means, and it's not something that we've started yesterday. We have worked with other regions, and what it means is working with them and actually helping on the tech transfer. We have financed tech transfers for help in that for a few companies because we know of the market. So it's a whole process that is going on there. But concretely at this stage, what it means is providing the support, the financial support as we talked about. And just to be clear, what we want is to keep a global price that is competitive, but in the meantime, subsidizing towards competitiveness the manufacturers that will be able to, of course, compete in tenders and have the pre-qualification. So the instrument is really structured in 2 ways. The first way, you do need to arrive closer to certification and having there a premium price, but it's not about distorting the price on the contrary, but helping the ones who need it, who are very close. So I think, clearly it has worked in some market in Asia and Latin America that we have been working for some time. So now it's obviously looking at it through all the regional lands, and that will be very important in that case. I'm sorry, I didn't hear well the last question because I don't know if it was with the mic, so I'm not quite sure actually about the question. and happy to answer then.
Absolutely. So the second two questions, the first was about the inclusion of people with disabilities, and the third was about the role of digital health and how that's playing into this picture.
No, okay, so in the terms of digital health, it's actually very important in the vaccination process, because it's true that we have talked a lot about the production, but it only works, of course, if the product goes to in the arm of the child or the person. And in vaccination is very important because it's about first identifying who has been vaccinated or not, and being following, monitoring and tracking. And we have introduced actually through a program that we have, an accelerator program that we have in Fuse, quite a lot of innovations there to help track quickly the children, to have reminders also to be able to follow the patients. But also, we, for example, recently introduced biometrics for children with innovators so that we can track them. It's very difficult actually to do biometric with children, so we innovated, and now we know already at 9 months we can trace them, to be able to trace it for the life. And actually it allows also to trace the parents and actually to be able to bring them to the point the minister was saying, to the facilities to be tested for other things. So we really think that it's very important. We have used a lot digital health also in the cold chain aspect, to be able to follow exactly what's happening on cold chain, how can we improve cold chain, and we bring it back actually to manufacturers so that they improve. So there's really a very important use there,
Thank you. Would any of our other panelists like to jump in on any of those questions?
Can I just jump in on a couple of things? One is, look, there are lots of important issues around IP and global approaches to equitable access from a sort of the rules of the game type of approach. The one thing I would say about all of those is they're important, they're also really slow. These are very complicated international debates. And my view on this is we need to be judged, in a sense, by what we're actually delivering. And so if I take TB, for example, in the last 8 weeks, we and partners, so Stop TB, USA, WHO, we've managed to secure 55% reduction in the price of bedaquiline, which is the main treatment for MDR-TB, a 20% reduction in the cost of cartridges for the main molecular tool, GeneXpert, and a 20% reduction in one of the key preventative medicines. And we need to keep delivering. And there are different ways we will do that, but that is absolutely critical to equitable access. I hear you on disabled people and their access to drugs and their vulnerability to HIV. Look, HIV, like other infectious diseases, preys on those who are already disadvantaged and marginalized in different ways. And that's why we are very... we see the answer to that as engaging with the communities of people who are most at risk, because it's the communities themselves who understand the particular needs and can work with us on how to overcome those access barriers. So if we're not doing that with you, then we should have a conversation about it. Digital healthcare, this is one of the things that, COVID had many bad things. It had a few silver linings. One of the silver linings is that it accelerated the development of digital consultation, use of digital media for prevention, all sorts of different aspects of it, the use of AI and so on. We're doing a whole array of this kind of thing. The thing that I think is most important, though, is that there are too many subscale little pilots of this sort of stuff. And if you really want to get impact that saves large numbers of lives, you have to have scalable platforms that affect millions of people.
Thank you. In the interest of time, which is running short, I'd like to take our last two questions and maybe
I was going to react maybe
Oh,
still?
sure. Feel free.
Yeah. I thought that we all should maybe say a few words.
Absolutely.
Peter Sands said a few things already about the about the red lines and the intellectual property rights, I do believe as well that we hopefully see more than just red lines. It is, you were talking about the necessity of long-term investment, and of course property rights are an important incentive for long-term investments, but also the WTO rules do allow for flexibility that can be used in this context. So I would like to emphasize what Peter said before. What do we deliver? And instead of just talking about red lines, in terms of also the digital healthcare, very important issue. We also have, besides our support to the funds and multilateral programs, we also have projects in our bilateral cooperation, but I would also agree that those are very nice projects, where, for instance, in one project was possible to track the COVID-19 pandemic and be able to react very quickly in some African countries, but it is something like a pilot, and systematic and global solutions and data governance would be really important. For the third point, the disability, we did have an event on this issue this morning on global health and disability, and I was saying there, Germany is going to host the Global Disability Summit in Berlin next year, and that we hope that we are really going to have a push and an impetus for this subject, and everybody to join in to advance in this subject, not only in health. Thank you.
Thank you. Feel free.
I just wanted to comment on the issue of access to people living with the different disabilities. Is that for Malawi, what we have done, we have devolved some services to do with the HIV/AIDS management to community healthcare workers. So even if you go to a village clinic, you find you have access to all commodities pertaining to the HIV/AIDS, to family planning. So we wanted to make it easier for the disabled to get the service. But also, when you are in a community setting, in a village setting, the community healthcare worker, he knows very well that in that house there's a colleague who is disabled, but they're on ART. So they can easily follow up, on referrals and things like those. Or if they have not come for the referrals, you follow up what has happened, if anything has happened. So we are doing that, and it's working very well. And also the HIV program is one of those programs which is fully digitalized in Malawi. Exactly, you don't have to go around with a health passport. No, wherever you go, you can go in the system and they'll have all your details. So we're doing that. But also, apart from the people with disabilities, even for our sex workers, we make it that, they have easy access. We have one-stop centers in the hotspots where they have peer groups where they encourage each other. So we have even integrated gender-based violence. If somebody handles them in a certain manner and they feel offended, they can also report. So we have these one-stop centers and hotspots where they have access to services to do with HIV, but also issues of GPV. Thank you.
Great. Thank you. We'll only have time for one question. I'm so sorry. Please feel free.
So, I want to thank the panel. It's very comprehensive. That's why it triggered 3 interrelated questions. To Mrs. Marie-Ange Serracayao. I fully agree with you about the at-risk financing. Yesterday we heard about the pilotitis. The pilotitis is very often reproached to NGOs. Why do they enter into the pilotitis? Because they have set up something and they do not get the support, so it remains at risk. They keep struggling below the level that they would really need to carry it to the next level. So, and all the big funders sit waiting there until you fall down, or maybe you struggle because, and I really want to ask you, please think about that. You need the NGOs, but we need to solve that, and I would like to get some information about that. The second is to Peter Sands about the sustainability. I find it a little bit difficult to talk about sustainable demand when we talk about NCDs and STDs that we would like to prevent and to get out of the world. So therefore, I do think we have a limited understanding of that, and it should not obscure or obfuscate the fact that perhaps pharmaceutical industry would like us to live with these diseases to make them eternal and therefore continue their production. So I do think that the public money cannot be avoided, and we must not undress our public services, but have a solid public service to make sure that equity and accessibility, even in far places, also occur. So maybe the public money could also be used sometimes for a little bit of risk financing. Thank you.
Thank you. Would you like to respond with your best 20 seconds?
Yes, I think,
Thank you.
just to be clear, I think we agree that at-risk money can be used with public finance. I think it's really what you want is to have the proportion and it to be catalytic and then bring in other type of money that can take more of the risk. And I think that's what often we see matter because, of course, as you heard here, public money is also scarce. So that's also the equation to be placed, right? With something that may not happen, with something sure that can bring the benefits. So I think it's really about that blending that we talk about. What's the proportion and how can it be complemented with other type of financing, private capital, and I talked about some of the bonds that we are doing. Yeah, so I think just to say that I'm happy to continue the conversation.
Thank you. Did you want to respond?
I think it was more of a statement than a question.
Fair enough. Fair enough. Thank you for your comments. I am sorry to say we don't have any more time for Q&A. I imagine there are many more questions in the room. I encourage you to come speak to the panel after the event. Sorry about that. But in conclusion, I really wish we had more time. It's been a really lovely discussion. As we wrap up, I'd be curious about kind of your last 30-second thoughts here, your closing thoughts on this discussion, anything we didn't cover, anything else that you'd like to say. And Minister, if we could start with you. Sorry to put you in the hot seat.
No, just to say thank you so much for the opportunity to interact. It's a conversation which has started. It cannot be an event like today that when we disperse, then that is the end of it. No, it is a conversation. But I wish we could have, timelines, a roadmap, a proper roadmap. What exactly are we talking about? What is it that we want to do, to see in the next 5 years when we're going to meet again? What would we have achieved our outcomes? So hopefully we'll get to that. Thank you.
Thank you.
Well, thank you. Last thoughts. Global developments are alarming. Multiple crises, when we think of Ukraine, Middle East, Sahel, food crisis, climate change, etc., shrinking spaces for the fiscal situation, which has been mentioned before, leads to decreasing domestic financing for health and human rights-related obstacles also. And so this is a difficult situation, difficult conditions, and again, we can only make progress together. Government, civil society, multilateral and technical partners, private sectors, and so on. As you mentioned before, I don't have a long history in health so far, but I find there's a very impressive landscape of institutions and partnerships and initiatives. There's so much that we can build on, and that's what we should do, build on it together, and we remain committed to support other partners and do our job on this journey. Thank you.
Thank you. After your time.
Could I request to donate my 30 seconds to that gentleman, as long as it's not a question? It's just a comment. I can donate my time. Please. Because you're the only one, so quickly. I'll not say anything else, I promise.
Thank you.
Good idea.
Right, as my colleague here says, never give up. So that's one of the things we've learned from the HIV movement is never give up. So one thing I wanted to say is I think we have mechanisms in place that have done a fairly good job, relatively good job, in terms of getting new small molecule oral tablet formulations for infectious diseases for people in low and middle income countries through licensing, through the work of a lot of organizations. The reality today, though, is that the innovations are increasingly more complex. And we're talking about long-acting PrEP was mentioned earlier. So we're working with many, and I'm from the medicines patent pool, by the way, many of us working with the innovators and with the generics and with others to try and get it right for those products. And it is more challenging. But then the next wave is biologics. That's where innovation is increasingly going. And already today, in non-communicable diseases, biologics are game changers. And yet today, access to biologics in most low and middle income countries is extremely poor. So the comment here is really, we need to be thinking also in terms of products of increasing complexity, long-acting biologics, mRNA, etc. And then also, how do we apply some of these models as well beyond HIV, TB, malaria, because increasingly that's where the key morbidity and mortality is happening in low and middle income countries, is increasingly in the NCD space. And we're not seeing that same level of access to health innovations as is mentioned in the title. Thank you.
Thank you.
Thank you, and thanks for yielding your time.
Well, because you donated your time to me, and he stole my message. You donated your time to him, and he stole my message. Because I think this is a very real challenge, which is that the pace of innovation in clinical science is phenomenal. And you've got everything with biologics, monoclonals, genomic, use of AI, all this sort of stuff. And if we don't get better at what we're doing, playing our role in terms of bridging and providing equitable access, we could end up in a situation where the inequities in global health, which are already pretty stark, could actually get worse. And it's worse because the science has got better. Because these are more complex things to sort of put through this kind of process. So I think we do have an interesting sort of collective challenge as to how we respond to that.
So I think it's perfect because, in a sense, what I was thinking is, Ariane talked about some of the challenges. I think more geopolitical and of course the climate ones. But the real challenge we have to work in here is that we have to work seamlessly at various levels. And I think it's about thinking or maybe innovating globally, discussing regionally, but how we support the minister acting locally. And I think that's really this circle that we have to be doing seamlessly so that we can bring the innovations. But we have this suite here now also to work on. And I think quite a lot to do, and hopefully in the weeks to come will be even further.
Absolutely. In other words, making the marriage work, right?
You said it.
What a great place to end. Thank you, everybody. Thank you to the panelists. Thank you to the audience, both in the room and online. It's been a really enlightening session, and we really appreciate your time. Thanks very much. Enjoy the rest of the conference.